Today marks World Patient Safety Day. It's aimed at shining the light on the importance of healthcare policies and safety interventions. Now, according to the World Health Organization, 1 in every 10 patients is harmed during healthcare service provision. The organization also reports that over 3 million deaths occur annually due to unsafe healthcare. To unpack more on this, we're joined by the Global Health Advisor at International SOS, Dr. Chris van Straten, who joins us all the way from Cape Town virtually. Dr. van Straten, thank you so much for your time this morning. Unsafe healthcare, what do they mean by that?
So Marcel, thanks so much for inviting me on the call. Pleasure to be here. Unsafe healthcare really focuses on aspects of healthcare or complex systems where a patient might get an injury or not get optimal care. And it's really about focusing on the different processes, procedures, behaviors, and technologies, and having create a safe environment for a patient that they get the right care at the right time and make a full recovery.
And we know we're talking about this based on global statistics, and one can only imagine that in the developing world, those numbers are even higher in terms of patients having to deal with unsafe healthcare.
Marcel, unfortunately, yes. So the statistics and numbers coming out of parts of the developed world, including America or Britain, that's about, they say, 1 in 10 patients might have an adverse effect, but in parts of Africa it might be as much as 4 or 5 out of 10. And some of that has to do with the poor infrastructure or support, lack of policies, and sadly in some instances too, where we've seen with the mass rolling blackouts, certainly having an impact on some of the safety of patients.
And one couldn't imagine that that is very much connected to the healthcare systems in various countries. And let's focus on Africa, if you will, where we know there are spaces where healthcare systems are struggling, where infrastructure hasn't been looked after. And we can look at South Africa, if you will. A day doesn't go by that we hear about a public hospital that's without water or without electricity. How does that impact what you call clinical governance in providing or taking that first do no harm approach to healthcare?
Absolutely. So Marcel, great question. And with all these questions, always, as you said, it's complex. There's many layers to it. It's not just about what the doctor needs to follow. All doctors, I'm going to give you an example. Let's say you're going to do an appendectomy. There's a very clear guideline, policy and procedure that surgeon needs to follow. And there's a whole team that work with that surgeon to perform an appendectomy. And if all the frameworks are in place, the electricity is in place, there's water, the patient can get the appropriate care and their recovery, because they need to recover for a day or two. Let's say they might be in ICU for a couple of hours, and then in the ward, if the electricity is not working or there's no water for the staff to wash their hands and at meticulous attention to detail with hygiene, the patient can then, for example, get an infection at the wound site and perhaps die from sepsis, which really shouldn't happen if all the appropriate steps and all the appropriate resources are working correctly, like electricity, like water, like procurement, getting the right antibiotics at the right time. Someone has to really look at the bigger picture and take a system approach to this particular issue.
How important is the role of the patient in this ecosystem of patient care? I can imagine that it would be important for more and more patients to know what their rights are when they are receiving care and be seen as partners in that journey, depending on what they're receiving treatment for.
Yes, Marcel, I think it's really the heart of the issue. Patients, and I'm going to use myself as an example, I hope you don't mind, but Marcel, I'm deaf. I'm profoundly deaf. And 15 years ago, I had a very serious infection that very nearly killed me. And the reason I survived, the reason I'm alive, and the reason I'm able to talk to you, even though I have technically a severe disability, is because of the excellent care, but integrated care that I had. So we had these amazing infectious disease specialist down in Cape Town overseeing my treatment. I had an amazing ENT, ear, nose and throat surgeon, the audiologist, the nursing team to help me reframe, recalibrate, and learn to live with this disability. Now, that couldn't happen if the team isn't integrated. It wouldn't happen if I don't have support from other people who had gone through a similar journey. And as we've all seen during the recent pandemic, misinformation, disinformation, people trying to sell you something that isn't actually right for you or might do you harm. So having patients being at the core of any decision making, being part of that team and doing the right things for them is really important. So we need to be making sure the patient has a voice. We need to be making sure the patient is part of the decision making. And here's the other thing too. I am a doctor, but I'm also a patient. We know that sometimes the patients might not understand the medications they need to take and might not take them appropriately or might not take their condition too seriously. And I'm going to use an example of hypertension. I've had my own patients who sometimes don't want to take their medicine. And it's important that we as doctors and we as patients talk to each other, can build that communication, build that teamwork, because at the end of the day, who wins? Everyone. The patient gets the right care and is able to live a full and productive life, reducing the cost. Healthcare is expensive, and if we can have effective outcomes, we also reduce the cost, and that's really important economically and for the country.
Okay, Chris van Straten there. Thank you so much for your time. Dr. Chris van Straten is the national or the global, rather, health advisor at International SOS. Thank you so much for your time. And thank you for sharing so intimately about your own journey in terms of patient care. We really do appreciate it as we mark World Patient Safety Day.